Well, health has emerged as a key front in the upcoming election battle, with Labor announcing an $8.5 billion funding boost for Medicare, only for that to be matched and then bettered by the coalition yesterday. So much for fiscal discipline on both sides. Joining us live is the Shadow Finance Minister Jane Hume. Jane, it's good to see you again this morning. So were you railroaded into this announcement to blunt Labor attacks yesterday?
Pete, the coalition has been consistent in its commitment towards essential services, guaranteeing essential services going forward, far from being railroaded. In fact, Peter Dutton was first out of the blocks to ensure that there was Medicare funding for 10 additional mental health places. That was in his first budget in reply. Peter Dutton's commitment to a quality healthcare service has been unquestionable throughout this term of government, yet Medicare, while they bleat an awful lot about Medicare, have taken 3 years to actually do anything about it. We'd invite them back to Parliament to pass any legislation or regulations that they need before the election begins, if their commitment to Medicare is so strong.
So your promise on this is at $9 billion. How are you going to pay for it?
Pete, for the last 3 years, we've been pointing to so much wasteful spending by this government. We've opposed billions, dozens of billions, nearly $100 billion worth of Labor spending that we would not have gone ahead with. So I don't think that's going to be a problem. In fact, it's now
So you haven't decided yet, though. You'll work it out later.
Pete, that's not at all what I said. I think you can point to a number of things that we have said that we wouldn't do and that we won't do when the coalition returns to government. But the fact is, at the moment, it's never been harder nor more expensive to see a GP. In fact, it's 45% more expensive to see a GP now than it was under a coalition government. Bulk billing rates have collapsed from 88% down to 77%, and there are 40 billion GP visits in the last under Labor that were not bulk billed, that they would have been bulk billed under the coalition. Now, that's simply not good enough. Labor's record on health has been abysmal. This is simply making up. This is dollars to make up for their failings. The coalition government would be committed to ensuring that there is a quality healthcare system that delivers for all Australians.
So, but for a party who says that, you know, it's big on fiscal discipline, that it can do a whole lot better than the current government is, I mean, does this really show fiscal discipline? And it's not just this announcement, it's nuclear as well, and without really explaining what cuts are going to be made to fund it all.
Well, Pete, I think we've been pretty clear where we would not go ahead with Labor's commitments.
Right, okay, but what are you going to cut?
A future made in Australia. Well, we've said that we would not go ahead with a future made in Australia. We're not going to go ahead with production tax credits for companies to mine things that they were already going to do. We wouldn't go ahead with the Housing Australia Future Fund, a $10 billion commitment that has delivered 0 houses, completed 0 houses. We wouldn't go ahead with the Rewiring the Nation project, 28,000 kilometres of poles and wires stretching right across the country. That's the equivalent of going round the circumference of Australia twice with poles and wires. These are all Labor commitments that we have opposed. There is plenty there. We want to make sure that Australians get a healthcare system that they expect and deserve. This is making up for Labor's failings, not the coalition.